Lateral or peripheral vision. Why it worsens and how to improve it. Lateral vision, also known as peripheral vision, plays an important role in the perception of the surrounding world, making a person's life comfortable and safe. Unfortunately, central vision is not enough to have a clear and full-scale picture of the world. Side vision functions. All people normally have central vision. For example, you focus on the computer screen in front of you and see words clearly if you are working or reading, or people and objects if you are listening to a lecture or watching a movie. At the same time, you do not clearly see what is on both sides of you, without specifically focusing on objects or objects. A wall, a pet, a flower pot on the windowsill, a stack of books, etc. This is lateral vision, or peripheral vision. It performs several functions we need. Namely, it helps perceive the movement of objects and objects, determine speed and direction, in particular on the road, navigate in space, do not collide with walls, sharp objects and people, adapt to changes in lighting, leaving a dark room to go outside or vice versa, create a three-dimensional picture of the world. When we have normal peripheral vision, 120 degrees, from birth, we don't even think about how important it is. Carry out an experiment. Roll 2 sheets of paper into tubes. Apply them to your eyes and walk around the room for 5 to 10 minutes. This will help you visually understand how much information we capture with peripheral vision every second. In medicine, this condition is called tunnel vision. Improved lateral vision. There are exercises that you can do to improve your peripheral vision, but provided that the deterioration of lateral vision is not associated with the development of ophthalmological diseases. So, the first exercise is called finger tracking. Sit comfortably. Raise the thumb of one hand and fix it at a comfortable distance from your face, but so that you can clearly see it. Slowly move your finger left and right, following it with your eyes. Repeat the exercise for 2 to 3 minutes. The second exercise is, at a distance, place 2 objects, such as books or glasses, on a table at a distance of 40 to 50 centimeters from each other. Sit in front of the table and focus on one thing for 2 to 3 minutes. Then quickly move your gaze to another object without moving your head. Repeat the exercise 2 to 3 times, changing the subject to focus on. The third exercise is behind the window. Sit by the window and for 10 to 15 minutes watch the movement of cars, people, birds, using only peripheral vision. Causes of deterioration of lateral vision. Lateral vision may deteriorate after a stroke due to impaired cerebral circulation due to chronic stress. But from an ophthalmological point of view, this is facilitated by glaucoma as a chronic disease in which the balance between the production and outflow of intraocular fluid is disrupted, and eye pressure begins to increase. The optic nerve and other structures of the eye experience increased stress, and the blood supply to the eye is disrupted. As a result, the optic nerve dies, and the connection between the nervous tissue of the eye, which sends visual information to the brain, is destroyed. Damage to the retina, such as detachment of the retina from the nerve membrane of the eye or thinning of the retina due to malnutrition, ocular stroke or retinal artery occlusion, stopping the blood supply to certain tissues of the eye or the outflow of blood from the retina due to rupture or blockage of the artery by a blood clot. Retinitis pigmentosa or retinal pigmentary dystrophy is the formation of pigment spots on the retina of the eyeball, followed by the death of photoreceptors, as a result of which a person goes blind. This is a genetically determined disease that occurs in 1 in 5,000 people. Insufficient vascular circulation of the optic nerve. Formation of eye tumors. In the case of the development of the above diseases, impaired lateral vision is a constant and important symptom that cannot be ignored. I advise you to urgently consult an ophthalmologist if 1. You have to turn your head to see what is on the right or left side. 2. You see much worse when it gets dark. Twilight vision worsens. 3. Dark spots of different sizes appear before the eyes from time to time. 4. You cannot read normally. Your eyes get tired during visual work. 5. Vision in one eye suddenly disappears or gradually becomes blurred. You feel pain, eye pressure, and see gray dots within your field of vision. Ocular stroke. Treatment of lateral vision impairment. Treatment of impaired lateral vision begins with a comprehensive diagnosis: perimetry, tonometry, ophthalmoscopy, visual acuity test. Once the doctor makes an accurate diagnosis, treatment will begin. It does not always involve surgery or laser vision correction. In some cases, for example, when lateral vision is impaired due to chronic stress or insufficient blood circulation to the optic nerve, drops, medications and a course of hardware treatment are enough. But if we are talking about glaucoma or retinal detachment, surgery and laser treatment cannot be avoided. However, in any case, treatment will be quick and effective when the patient does not hesitate to visit a doctor. And, of course, I remind you that you need to check your vision not only when something bothers you, but every year. Impaired peripheral side vision. One of the common pathologies among peripheral vision disorders is tunnel vision. This anomaly occurs as a consequence of pathological changes in the lateral parts of the retina. Tunnel vision syndrome is a condition in which a person is unable to see with peripheral vision. Visibility is possible only with central vision, and the visible field turns into a kind of tunnel, where vision is blocked in the periphery. Tunnel vision syndrome can occur for several reasons. Among them is an overdose of prohibited psychotropic substances, which can also affect visual function. Prerequisites also include prolonged oxygen deprivation, nitrogen vapor poisoning, chronic stress, and sudden changes in pressure. Other pathologies of peripheral vision may also be associated with damage to the retinal tissue as a result of injuries, foreign objects entering the eye, or impacts. All this can provoke retinal detachment, in which a person begins to lose vision from the periphery. Treatment of peripheral vision disorders. Treatment for tunnel vision syndrome in most cases is lengthy and time-consuming. During this period, it is important to ensure the patient's safety at home and at work. Remove dangerous objects that a person may not notice with peripheral vision. For example, knives, sharp corners, any other sharp objects. If the patient drives a car, it is better to limit or completely eliminate driving during treatment. Otherwise, there is a risk of accidents. As a pedestrian, you also need to be careful. It is better for the patient to be helped by a loved one to cross the road, who will make sure that it is safe to cross the street and that there is no car rushing from the side. Treatment of lateral vision disorders can be medicinal and physiotherapeutic. In extreme cases, surgery may be required. As a means of drug therapy, the doctor may prescribe drugs aimed at eliminating swelling, improving blood circulation in the organ of vision, normalizing intraocular pressure, the functioning of the optic nerve, and improving metabolic processes in the tissues of the eye. Drip therapy can help improve peripheral vision.